want to come back to the staffing issue that you talked about before. There's a lot of press, really since the pandemic started, about the Great Resignation and the staffing issue throughout healthcare. But in many ways, there were many things that are just not promoted or not reported on. And you referenced the staffing issue relative to leadership in this space. I can't remember what the original stat was, but I know it's dropped significantly, that the average across the board for skilled nursing administrators now staying in their role is about 2 to 3 years. Skilled Nursing News has often talked about how people used to get into the administrator roles and would stay in that role for their entire career. Now that's just not the case. What can we do to help to bridge that gap that we're seeing at the administrator or the leadership level?
Well, I think it's certainly it's about having a network of support. In many cases, there are still individuals coming into the profession. Many of them are coming straight out of school. But I do see where there are individuals who are kind of second careerists making switches. Yeah. For one reason or another. They've had this calling to come into the profession. And I think, regardless of whether you're a young person who is very early on in their career trajectory, or a second careerist who is just trying to, get up to speed with the nuances of this profession as opposed to other types of business. It's about having that network of support. And that involves, proper preparation for entry to practice. That includes the administrator and training experience. Virtually all states require a quote AIT experience before you can sit for your license exam. And so we work in collaboration with the National Association of Boards, or NAB or NAB, to develop a very effective and comprehensive AIT program that allows an individual to work with a preceptor to make sure that they're covering the content that is important to enable them to be successful in passing their license exam and moving on into the profession. It doesn't stop there. Once they pass that license exam, then it's important that they get off to a good start. And so, our association has the gold standard mentoring program and a wealth of institutional experience and knowledge out there to pair with individuals in a mentor and protege relationship, so that they have that support mechanism that is objective and non-threatening in terms of whether you're working with a multi or a situation where you may be less likely to express your concerns or your fears or your to say I don't know.
Yeah.
So a mentor is a critical piece of success as the individual moves into the profession.